It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. Why does my dog have blood in his stool? If your dog suddenly has a bloody poop, you definitely need to talk to your vet. However, it is not always an emergency situation. As disgusting as it sounds, take a closer look at the blood in your dog's poop so you know what to do. Reasons why your dog is defecating blood. The presence of blood in dog poop means that there is bleeding in the gastrointestinal tract. There are two types of bloody stool, Hematochezia and melena. The appearance of the stool indicates the source of the blood. The mane is usually more serious than Hematochezia, but both usually require veterinary intervention. Let's talk more about these two types. 1. Hematochezia. Hematochezia is the passing of bright red blood, with or without stool. This means there is bleeding in the lower digestive tract, or large intestine, which includes the cecum, colon, rectum, and anus. You may see streaks or spots of red blood in your diarrhea or normal stool. Or, you may notice the dog pooping pure bloods. Diarrhea along with red blood is a common sign of colitis in dogs, which has a number of causes, including intestinal parasites, inflammatory bowel disease, infections, food allergies, stress or anxiety, and more. Other common causes of red blood in dog poop include the following: constipation, polyps, tumors, anal gland problems, trauma to the lower gastrointestinal tract. Diarrhea itself can cause bleeding from the large intestine due to irritation in the lower gastrointestinal tract. If you notice blood stains on your dog's bedding, you should investigate further. While the blood may be related to the gastrointestinal tract, it could actually come from your dog's urine or injury. In either case, call your vet for advice. 2. The mane. Mane is a black, tarry fecal matter that is usually sticky or gelatinous. The blood appears black because it has been digested. This points to bleeding in the upper digestive tract, which consists of the mouth, esophagus, stomach, small intestine, liver, and pancreas. Common causes of mane are as follows: hemorrhagic gastroenteritis, gastrointestinal ulcers, cancer, tumors, bleeding or coagulation disorders, trauma to the upper gastrointestinal tract. The melena can also occur from swallowing blood. This can happen if your dog has oral bleeding caused by periodontal disease or injury. Be aware that some healthy dogs will have very dark stools that are not actually mane. If the stool is formed and has a normal consistency, it is probably normal. You can take a closer look by wiping up a small amount of feces with a white paper towel. The mane will have a dark red hue. Dogs given bismuth-containing medications, such as Pepto-Bismol, may pass dark-colored stools, but that's just a harmless side effect and not actually digested blood. If you are in doubt as to whether there is blood in your dog's poop, take a sample and contact your vet for advice. If your dog's poop is of a normal consistency, but you see a small amount of blood only once, then take a mental note and keep a close eye on your dog. Contact your vet if the bleeding continues or if your dog shows signs of being sick, such as lethargy, vomiting, or diarrhea. If you regularly or frequently see blood in your dog's stool, either red or black, it's important to see your vet. This applies even if your dog appears normal and healthy. It's also a good idea to get a small sample of your dog's poop to take to the vet. Certain circumstances constitute an emergency. Take your dog to the nearest open veterinary center if you notice any of the following symptoms: profuse bleeding from the anus, extreme lethargy, collapse or loss of consciousness, pale or white gums, possible exposure to toxins, vomiting with blood or a dark substance that looks like coffee grounds, digested blood. How to prevent your dog from pooping with blood. Some conditions simply cannot be prevented, but early detection can help your dog get treated before the signs become severe. Watch your dog's poop so you can spot abnormal stool when it starts. Contact your vet if your dog experiences vomiting, diarrhea, or any other abnormal symptoms. There are some situations that you can prevent. Dogs sometimes get sick after eating something they shouldn't. Keep dangerous items out of reach, including human food, trash, caustic substances, and small parts that can be swallowed. When you are outdoors, keep a close eye on your dog to avoid exposure to toxins, wildlife, and other dangers. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.